pharmacies in the state. Most of them are based in New South Wales, but we have a couple of members scattered in different states and territories. So we've had quite an exciting few weeks and months leading up to vaccinations, as you guys would be aware. And yeah, I'm looking forward to sharing some of my insights in community pharmacy.
So to kick off, can you tell us a bit about your journey since graduating university? What course did you do, and where has your degree taken you?
So I did actually a Masters of Pharmacy at the University of Sydney. Beforehand, I did a Bachelor of Science majoring in pharmacology and chemistry, also at the University of Sydney, where I had the pleasure of spending a lot of time at the university and getting to know some of the academics there, including Andrew. Andrew, you guys are pretty lucky to have him. I'm a big fan, Andrew. But since then, I've began my career in community pharmacy and I've continued in that ever since. I actually did my internship with Chemist Warehouse, where I went on to manage one of their pharmacies for a period of time before transitioning out of that model in community pharmacy and into more of a professional services-based model in MediAdvice. So I've been with the MediAdvice group for the last couple of years now, where my role focuses majorly on helping pharmacists roll out professional services, assisting them in things like vaccinations, dealing with COVID operationally, what that looks like within the pharmacy space, and the considerations that need to be made there. I also spearhead some of the negotiations on behalf of our members on the business side of things to assist them in procuring stock essentially at a better price to allow us to provide the services to patients and customers in an equitable way, and dealing with accreditation, which is a lovely aspect of my I guess role as far as being a chief pharmacist at MediAdvice. We assist our members in making sure that all the procedures are in place and we can deliver services in a quality way.
So what really drew you into community pharmacy?
I made that decision when I was completing my second year in a bachelor's space, and I just love the profession. Actually, community pharmacy is what drew me into the profession. I love the fact that you get to interact with the same people and take after their care on a more detailed level, and we have a great opportunity to actually intervene more frequently than any other healthcare professional in the community pharmacy space, where you get to see the same people over and over again, and you get to assist them in greater level of detail as far as picking out things that have changed, assisting them in managing their medicines, and contributing firsthand to better health outcomes. So,
yeah, I think a lot of us can agree that's the drawing for community pharmacy and why we love it so much. So following on that, what do you see the future of community pharmacy kind of looking like, I guess? Do you imagine pharmacist roles to shift as a result of this pandemic, and also like things such as increase in technology?
Yeah, so definitely there's been a lot of stresses in a lot of different industries, including pharmacy, since COVID knocked on our door. The pandemic has shifted our model as far as it actually, I guess, shined a light on pharmacy to show the value that we add to our community when things get out of hand, and the level of support that we can provide individuals within that space is really important. But at the same time, it's caused us to think about different ways to provide those services in an efficient way. It made us think about what the online space looks like, what delivery space looks like, what automation looks like, and how that can be implemented to actually push the pharmacists out of the, I guess, mundane day-to-day operational stuff and get them more involved with services like vaccinations. Obviously, there's been a great stress to get our communities vaccinated. So, and the best way to do that is to take the pharmacists out of the dispensary and get them providing those services. And I see that continuing moving forward. I think there'll be a great need for us to come up with ways to remove the pharmacists from behind the computer onto the floor, with things like automated dispensing, with companies like BD Roa already providing solutions there, with software providers like Script, for example, creating CRM systems where you can help manage patient requests in an automated way, And it's all about creating efficiencies. And I think technology will play a big role in that. So the community pharmacy, I think, is a very exciting space at the moment.
Yeah, I think we all can agree we can't wait to see it develop in future. In saying that, what do you think makes a good community pharmacist? What do people look for?
I guess the most important thing is communication. You can have all the knowledge, clinical knowledge behind you, but as far as being able to create a conversation with someone that's actually taking those medicines and trying to get the right information out of them is critical. I think communication skill has to be the most important skill to develop whilst you're at university and during your internship. Clinical knowledge is super important, but that can be taught in textbooks. Whereas I think the most critical skill that can only be taught through interaction is communication. And you just need to get out there and get yourself comfortable about conversing with patients and even fellow professionals. And once you get out in the professional space, your precepts are super important there, because they would have experienced a lot of different interactions with patients, and they would have picked up different ways on how to actually get the right information out of the patient. So that's super important.
I'm late.
Sorry, guys, can we just ask again if everyone can just mute their mics? So following on that, we hear about pharmacists having, I guess, specializations in community. How can we undertake, or what can we undertake to expand the scope of our careers?
So the biggest thing at the moment, obviously, is immunisation. So it's something that will be with us moving forward, I think, for the foreseeable future. And I think that we might be even participating in NIP programs moving forward, hopefully. So that's one aspect as far as the expansion of our professional services. But there's also the aspect of, I guess, being an accredited pharmacist, where you can actually provide those services in the patient's home or for residential care purposes. So being accredited definitely helps, and it guides you in the expansion of your clinical role as a pharmacist to be able to break down a particular case and look into it in more detail. And there's things like being a diabetes educator that can be done to look after patients that have long life chronic diseases like diabetes, for example. So the management there is normally lifelong, and to be able to expand within that and be a professional in that space is super important in the community. But in saying all that as well, I think a community pharmacist needs to be, I guess, if we were to draw an analogy into other medical spaces, we are like the GP of community of I guess pharmacy itself. We need to know and be able to pick up on a lot of different things, and then we'll be able to refer our patients for the right care. So that's also super important.
For sure. And are you able to tell us one of your favorite memories in community pharmacy that's probably stuck with you and impacted your career in a way you didn't expect?
There's quite a lot of memories. It's hard really to pinpoint a single memory. I think community pharmacy, because there's a high level of interaction with a lot of patients, and you tend to form meaningful relationships with those customers and patients that you see on a daily basis. I think the best time for me is actually around Christmas time, when all your regular customers come and bring gifts into the pharmacy to show their appreciation and what difference you're making within their lives. I think every year I look forward to that time, and hearing from my patients around, normally is a joyful time of year, and to know that, you're in their thoughts, that you've contributed positively to them as a pharmacist, that's super important. So
definitely. Christmas is the best time of the year anyway, no matter what.
Yeah, for sure. Definitely.
So that's it for our questions now. And I'm going to hand over to Elle, who will guide us through some of the student asked questions.
Thank you, Assaad, first for sharing your experience with us, and thank you for all the work you've been doing as well regarding the vaccination. We really appreciate the role that you're playing in this critical time, so thank you. So just regarding... Okay, regarding student questions, so we just have a question sent to me. What is a misconception that you had about community pharmacy that was proven wrong once you started your career?
The biggest misconception that you hear, I guess, in the community space is, we're just dispense techs, stuck behind a computer, printing labels and handing out boxes. The role of a community pharmacy or pharmacist within the dispensary is, the dispensing journey is very detailed, and you have to be able to break down a lot of information quickly to be able to provide a healthcare service. There's a lot hidden between that label and the box, I think, and there's a huge misconception there within the community as far as the level of detail that pharmacists have to go through to be able to provide the medicine safely. So obviously, as you become interns, you'll see that speed is one thing, but being able to break down a high level of information in the correct way to be able to provide medications safely and to be able to intervene when necessary is super critical.
Yeah, no, of course, and this is why we are here as community pharmacists. So definitely, yes. Another question that I have is, what's something you found very different in practice compared to theory you would have learned at uni?
I think the application of clinical knowledge is very different as far as what you're taught in uni and what's learned specifically during your intern year. I think it might be the same in different spaces and fields within pharmacy, but your preceptor teaches you a lot of information that you might not otherwise know just coming straight out of uni. So if you find that your skills are lacking in that regard, not to stress, you probably share the same level of skill with all your peers, but it's very important that once you get out of university, you make the most out of your first year. It's super important because it tends to shape the decisions that you make as well as your career moving forward. So make the most out of the first initial year, I would say.
That's some great advice. Thank you. Does anyone have any other questions? Also, feel free to unmute your mic. Oh, we have another question. Do you find community pharmacy stressful due to the huge amount of pressure the pharmacist is placed under?
So this is an interesting point, especially these days with our, I guess, scope of practice expanding. And I guess I'll take that point back to, I guess, where technology plays a role. I think the next 5 to 10 years is going to look very interesting for pharmacy, where a lot of the tasks will be taken over by automation, and that should relieve some of the pressures that pharmacists have. At the moment, there is a lot of pressure for pharmacists to perform, and it's been an outstanding level of pressure for the better part of 18 months. A lot of patients are flocking into community pharmacies for advice and for care. And with the continued expansion of our scope of practice, especially during this COVID vaccine rollout, the amount of pressure and burnout does increase, or the risk for that increases. So we need to be able to look further, I guess, into the future as far as how we can automate some of the tasks that need to be done in a safe way, so we can take the professional out of those mundane tasks and they can perform other professional services that are key. That will relieve pressure and it will continue to expand our scope of practice.
Yeah, thank you. Thank you for your answer. We do have another question as well. Are there any, I know you already touched on that with the diabetes educators, for example, but there's a question asking, are there any additional accreditations a community pharmacist can attain, including things like HMRs? Yeah,
so I've touched on that a little bit. There's a few different things that can be attained. I think the community pharmacist role has to be, a jack of all trades role. And then you can, once you master that, you can then look forward to seeing what kind of specialties you can undertake. The hospital pharmacy space, for example, has a lot of specialties that pharmacists can undertake. And I guess community pharmacy can guide your decision-making as far as progressing your career. There isn't as many opportunities for specializations within community pharmacy compared to hospital pharmacy, for example, but you should take the opportunity to really explore your interests and then make decisions on that moving forward.
Okay, thank you for that. So we also have a few other questions. How did you go from interning at Chemist Warehouse to management?
It was a lot of curiosity, self-driven curiosity. Managing a pharmacy you have to incorporate within your thoughts how the pharmacy model operates currently. You need to take into consideration some financial and operational aspects in business outside of your clinical responsibilities as a pharmacist. So the transition was very much based on my curiosity and me asking a lot of questions. And that curiosity just kept, I guess, expanding my level of knowledge outside of if I was to take my pharmacist hat on for one second, put my business hat on, that really has driven my career progression as far as expanding my roles within community pharmacy. Be curious, ask a lot of questions, and take action. And I think if you take those steps, you can move into a management position if that's what you're interested in.
Okay, thank you for that. I'll just quickly go over the 2 questions that we have in the chat, and then we need to move on to our next speaker. But thank you for sending those questions. So next question is, do you believe that pharmacists are being remunerated fairly for the amount of service they provide?
That's a tricky question. It's a great question. I think our level of skill and knowledge is not remunerated as well as it should be. And that's due to some limitations as far as applications of our skills in an efficient way. Again, that falls back into the technology space. I think as an industry, we're a bit behind as far as maximizing efficiencies in technology. And as we learn to maximize those and create new revenue streams within community pharmacy space, I think we'll see an increase in remuneration for our skills and level of knowledge. And we do save the economy quite a lot of money by our interventions. Pharmacist-led interventions are a lifesaver, literally. So we just need to create efficiencies around that so we can allow us as a profession to lead that space. And we should see as a result an increase in remuneration.
Yes, thank you. Thank you for that. Final question for Assaad is just any suggestion for how to get the first job in community pharmacy?
Apply. There's a lot of pharmacies looking for interns and assistants, especially these days. I'd be surprised if you don't go door knocking on your local community pharmacy door that they wouldn't take you on even for a couple of days. So call around. Pharmacists need some help at the moment, especially with the increased workload that we're experiencing. So call around, knock around. I'm sure our fellow pharmacists will take you on and guide you in your early stages of your career.
Okay, thank you very much for that. And thank you to everyone who asked their questions. I'll hand it over to you, Annabelle, now. Thank you, Assaad.
Okay, so next up we have our incredible hospital speakers. So we have Stuart and Fallon here tonight with us. Hi guys, how are you?
Hey, well, thanks. Good to be here.
So to kick off, I guess we want to know how you both are in terms of COVID situation in hospitals right now. How have you seen pharmacists' roles shift and evolve?
Fallon, how you doing?
Oh, great. I'm getting very good at Zoom calls. I have to show you that.
Yeah.
Do you want me to kick off, Stu?
Yeah, why not?
Okay, fantastic. So I guess I currently work at Royal North Shore Hospital in northern Sydney. So we're kind of a little bit more fortunate at the moment that we have less COVID within our general populace. But I guess from a staffing perspective, obviously, we're trying to share a lot of our staff with other health districts within New South Wales Health, and we're also working on the vaccine rollout in conjunction with the community pharmacies as well. So for us, everything really at the moment is to do with COVID. We're having a lot of changes in our general ward areas, so how we would usually treat our regular patients has changed significantly, and our patients have changed quite a bit as well. So we've cancelled things like our routine surgery to make room for COVID patients. And we're also trying to offset a lot of the somewhat non-acute presentations that we're getting to ED to GPs and community practices to try and assist to keep them out of hospital.
Yeah, I'll add to that. I'm a pharmacist. I'm the director of pharmacy over at Bankstown Hospital. We're reasonably close to the epicenter of kind of current events, but Bankstown, we're pretty lucky, really only from a strategic point of view, that some of the other hospitals in the district have been the main priority for COVID patients. So in a way, we're similar to Fallon. We've got pharmacists off doing pop-up clinics. A lot of our usual activity is either reduced or completely changed. So it's a great time to be an innovator and flexible and agile in hospital pharmacy. That's not necessarily a core function of the average pharmacist, especially the average hospital pharmacist who loves a lot of stability. So we're having some interesting times. Yeah.
Yeah, sounds a bit crazy right now, hey. But I guess some of us get a bit confused or may not know what a hospital pharmacist does day to day. Are you able to give us a brief rundown on jobs and what the day-to-day life of a hospital pharmacist looks like?
Yeah, I'll go first this time since Fallon let me last.
Very democratic.
Yeah, I think one of the things, and kind of rolling into that, the great thing about being a hospital pharmacist is the variation. Given the current scenario, 12 months ago, you probably would have guessed, 2 years ago, things like doing clinical pharmacy or working as a hospital pharmacist from home would have been an absolutely foreign and probably laughable thing for most pharmacists or directors of pharmacy to talk about. But so currently, my team, I have about a third of them on any given day working from home. It's really great with the access we've got to the network in terms of the clinical systems and things, but it hasn't really changed what we do. We're probably still doing about 95% of what we normally do. We're just doing it differently. As a clinical, when I say clinical, there's kind of two parts of everything in hospital. Everything in pharmacy, for the most part, is around being clinical. That's why we're pharmacists and not, I don't know, accountants. But we have our operations in our dispensary is the way our hospital split, and then we have pharmacists who spend all of their times on the ward with patients. So it's quite good for the pharmacists. They get that variation. Normally for 3 or 4 months, they'll spend their whole time in one particular specialty. They'll spend their days reviewing patient charts and biochemistry, doing medication histories to make sure that that medications are correct and safe. In terms of new medicines, depending on the pharmacist and either their skill level or their interest or their job title, they might be involved in multidisciplinary teams with doctors and dietitians, nurses, speech pathologists. Some of them might be writing policies more than others. Some of them may just really enjoy the operational side. So we have people who do spend all their time in dispensary. How about you, Fallon? Anything extra?
Yeah, I'd probably just add to that some aseptic production as well. Yep. So we do a lot of production of chemotherapeutic agents and TPN, so our parenteral nutrition. And then also it's kind of more our quality teams as well. So within pharmacy, I guess you have your teams which are up on the ward and interacting with patients. And then we also have those teams that are down in pharmacy, as Stu kind of alluded to, kind of writing the policy. But then we also have things like meds info, where doctors, nurses, pharmacists can call up pharmacists to get answers to clinical questions, which they may not have the resources to answer on the ward. And other pharmacists like quality use of medicines pharmacists. So they're looking at our processes in our department and our processes across the hospital and trying to work out where we can do better and improve patient care as well.
Wow. So basically we're very busy people at hospital.
Yeah, lots of variety.
Variety, yeah. We're all busy and there's just lots of different things for us to do, yeah.
So I was going to ask, what are the main differences in comparison to community? I think you kind of covered that, but I guess touch on it a little bit more.
Yeah. Do you want me to jump in first this time, Stu?
Absolutely.
Yeah, okay. I guess the main thing that I see is potentially the amount of face-to-face interaction that we have with other healthcare professionals. So on a day-to-day basis, for instance, if I'm working a clinical load for the day, I'll do a ward round in the morning and I'll be talking with doctors at the point of care of prescribing for those patients. And I'll be there with the nurses when they're administering those medications to the patients, just to give them advice on how to give it, or maybe to ask the doctors to change a dose, or maybe consider another alternative option based on the patient's comorbidities or other medications and potential interactions. So I guess we're really fortunate in the sense that we are there at that point and we don't have to do it retrospectively. I think oftentimes the challenge in community is you often get that script after the doctor's written it, and then you're trying to contact the doctor and chase them to get something amended if you think there is a better clinical outcome or situation for the patient.
For sure. Well, in saying that, are you able to tell us how you got to your current position, pretty much your kind of journey from university, I was going to say high school, from university to graduation, and like where you are now?
Go for it, Stu.
All right. Well, since you said high, I mean, I think it might as well start at high school. I actually was going to be a nurse when I left high school. I like to keep my options open. I was originally thinking of doing nursing, and I did a nursing and science degree. Turns out I didn't really want to be a nurse. when I started trying to avoid all the nursing subjects. So in the end, I just stopped it and finished my science degree and then did pharmacy. But so I did my internship at Concord Hospital. I love how stuff works. So having the opportunity to sit and look at biochemistry and think of the problems that people have come to hospital with, it really suits me and my personality and how I like to think. So it was really quite an easy pairing for me. I guess I've jumped around a bit since then, really, I guess, pursuing the opportunities that have come up. I guess my clinical training and my area of love and expertise is in critical care. So particularly in the intensive care unit and as well the emergency department. Fallon's nodding because she is a similar breed, and we, it again just comes down to, you know, we've said, well, what do you do as a hospital pharmacist? It's so diverse that there's the diversity in hospital pharmacists is as much as a diversity between a hospital pharmacist and a community pharmacist. We're all pharmacists, but we're also individuals, and that aligns with hospital. I'm now in a management role, which is some good fun. The challenges are probably bigger than any single challenge I ever had to do as a clinician. But I see my role now as being able to enable others to get the best and to push quality and safety further. Whereas before, for me, it was about, you know, doing my best for the patient and or the unit. I have a real privilege, but also a responsibility now to maximize my ability by supporting others. And I guess that's how I see my role.
That's really good. And Fallon, how about you? What was your journey like?
Yeah, so I did an undergrad pharmacy degree up in Queensland. And then throughout that undergrad, I worked in community pharmacy for all 4 years. And then I also, for year 3 and 4, worked in hospital and community. So I decided to do my intern year with Queensland Health in a hospital up on the Sunshine Coast, which was really nice near the beach. And throughout that time, I also worked in community on the weekend as well. But after the end of that year, I absolutely loved hospital pharmacy. I loved all the really interesting drugs that I got to see. I loved the patient interaction. And I know Assaad alluded to the fact you get to build relationships with community patients, which we kind of don't get in hospital, but you do get the luxury of being able to sit down with them for half an hour and have a chat about their new NOAC, which is given because they really don't have anything else to do, which is quite a nice luxury. After Queensland, I moved down to the ACT. I tried a few different specialties down there, including AMS, some Gen Med, some ED, and I settled on ICU. I thought it's a really interesting area of practice. I guess throughout our pharmacy degree, you always look at the doses and what you're using medications for based on the information that's provided in the PI. And that really, as you guys all know, is essentially what we should use the dosing and drugs for in healthy kind of 18 to 25-year-old males. Whereas if you look at the ICU population, there are just so many pharmacokinetic changes that are made in those patients when they get admitted. And you can really drag out all those principles that you've learned at uni and put that into practice in first principles when you're in that type of environment. So I absolutely loved it. I got to a point though where the doctors would ask me some really weird questions. So where can I put this medication? How can I give this really random SAS medication? I've taken out this part of the bowel. Will this medication now absorb there? And I was left like researching this stuff for like 30, 40, 50 minutes and coming up with nothing. So I decided, you know what, I should probably go and learn how to find information, because that would be really handy for my role as an ICU pharmacist. So I went and did some medicines information training as well, which was really interesting. And as an advocate for medicines information pharmacists in hospital, I think they're a great resource because you have access to all of these books, and knowing exactly where to look to find the information is just so important and can save you so much time, because it's just absolutely impossible to know everything off by heart. I guess I stayed in a hybrid meds info ICU role for quite a while. And then someone, my director of pharmacy pushed me when our deputy director left and said, oh, you should try management. So subsequently, that's how I ended up in the deputy director role. I think that's a lot of times how pharmacists do end up in management roles. We actively don't seek them per se, but they're kind of like, oh, you're good clinically, give it a try. And then, as Stu said, now my role is really about making sure that my team is put in the best possible situation to provide awesome care to our patients in the hospital and really supporting them to do their best as pharmacists.
Wow, that's very interesting. I was also going to ask, what's the best way to get into hospital pharmacy? Because you're selling us all on it. So difficult to get into hospital pharmacy if you don't get that internship, because obviously in especially Sydney, there's very few and there's high demand.
Apply, as Assaad said, apply. Like, honestly, there are some positions that we advertise for and you get like amazing candidates, 10 amazing candidates for this one position. And there are other positions where you literally barely get anyone applying. So just apply for everything is my recommendation, but you might be a little bit more pinpointed, Stu.
No, I think you've hit on the head. I think the best way to get in is the way that gets you in. That might sound silly, but there's lots of opportunities and there's no one way. Fallon's kind of given that example that I've gotten in through a hospital internship. Fallon spent time in community and she spent time in hospital. She spent time interstate. Some of the best pharmacists I've worked with have spent plenty of time in community pharmacy and then wanted to change. A permanent job isn't necessarily the easiest way to get in, but as Fallon said, sometimes we'll be looking for someone for 12 months and just being able to, for example, like a permanent position, maybe 40, 50 people apply, especially at North Shore. That being said, for a 12-month position, maybe 12 people apply. So being flexible with what you would accept as your plan, and I think having a really big focus on your goal is probably the best thing you can do, because I know seeing a few things pop up, someone said, what do you do with dealing with disappointment? And I think that also rolls into this, that the best way to get in is the way that gets you to where you want and that you're reassessing your goals and that you're happy with yourself in that you've done the best you could on that day, because there are a limited number of jobs and all you can do is prepare yourself as much as you can and then learn from that if it doesn't work out the way you expected.
For sure. And on that note, is there anything we can do, I guess, to maximize our chances? Like, for example, is previous hospital experience necessary or is honours necessary?
No, I would say no to either of those.
Yeah, nothing's necessary.
Nothing's necessary apart from curiosity and passion and good communication skills, really. I think all of the skills that you'll learn in any area of pharmacy are transferable. In our hospital, we hire at least 1 or 2 pharmacists who have no hospital experience each year, as predominantly, as Stu said, to come into our temporary positions. But yeah, do you want to add anything to that, Stu?
Yeah, look, I think to go back to what Assaad had said in community pharmacy, the number one skill that I'm looking for in a pharmacist, and every time I do an interview, I focus on this more and more as being my priority, is not someone's book smartness or their depth of knowledge. It's 98.5% about their ability to communicate clearly, and to build relationships, because none of what we do, I mean, essentially as pharmacists, we're only stepping in when we think we're right, which we're pharmacists, so we would have made sure we were, and 2, that we're concerned that if what we think is right doesn't happen, that's going to have bad outcomes for a patient. So if we're always right and it's always about patient safety, then what really matters is being able to communicate that in a way that someone listens to you and makes a change. So the knowing is less of an issue than the communicating, because you're always right as a pharmacist. You wouldn't jump in if you weren't.
I guess we trust that Andrew and his team at USyd have done an awesome job of making sure that you guys know everything that you should when you graduate. Otherwise, you wouldn't get a Bachelor of Pharmacy when you leave. So you have the knowledge. Yep, thumbs up, Andrew.
Yeah.
Yeah. you have the knowledge. We trust in the system. And so we're just looking for people who are enthusiastic and really want to come and work in hospital.
That's true. I think since it's just flicked up in my brain, last night I started reading Mythos by Stephen Fry on the Greek mythology.
I have it on my shelf.
Yeah, and I have now learned about where we get the word mnemonic from one of the Greek second order gods or something. But basically, she started off life knowing nothing, and people thought she was dumb. But she actually every day learned more, and basically she built up knowledge over time. And I mean, that's what we do as humans. She has memory. You always can learn everything there is to know, but if you can't communicate that, then it's pointless.
I think that pretty much covers our next question, which was going to be important attributes for a hospital pharmacist. And I think that's pretty much communication now.
I would say it's flat out easily the most important thing by a long shot.
Yeah.
And then we also hear of many pharmacists having specializations in hospitals. Like, for example, you were saying ICU pharmacist, etc. How does a pharmacist get this specialization, I guess?
I'll let Fallon answer that. But I will say before she does, just because you have Fallon and I online who are absolutely in love with critical care. And later, I think you're going to hear from Amy Thomson from Poisons, who is an emergency medicine specialist. Most hospital pharmacists don't like ICU or ED, especially ED. So don't feel like you've got a disproportionate look at the pharmacy population when you listen to the three of us talking about that. Most people don't, particularly ED, which is a very unknown area. But that's my caveat. But Fallon.
Yeah. So I guess as far as getting into a specialty area is concerned, there are probably two primary ways that you can do it currently in the hospital system. So the first one is to luck out and get yourself a specialty position if there is one available in a hospital. And unfortunately in New South Wales, our staffing levels at the moment aren't really conducive to having a large number of specialty roles, but there are still some out there. So for instance, at our hospital, we have a specialist mental health pharmacist. We have specialist BMT, so bone marrow transplant pharmacists. So they deal predominantly in hematological patients. And we also have specialist renal and ICU pharmacists that we recruit to. So in order to get one of those roles, essentially you could either do self-directed study, where you work your way through, you do rotations through those areas, and you build up your knowledge slowly in that self-directed manner. The other option now also, the Society of Hospital Pharmacists of Australia, SHPA, have what they call an advanced training residency program. So they have two residency programs. One is foundational, so that gives you a good broad understanding of all the different areas of pharmacy. So you rotate through medical, surgery, specialty areas, service areas. And then once you work out what you want to direct your energy towards or what you have a real passion in, then you can do one of their advanced training residencies. And that kind of it's the first time really that it's kind of formalized a specialty pathway for pharmacists in Australia. And I think that in hospital will probably be the way that we'll essentially start heading in the next kind of 5 to 10 years. It's modeled very similarly on the model that doctors have, probably just scaled down a little bit slightly in its seriousness, but I think that it'll be a great way for pharmacists to be able to gain that knowledge and also complete the competency framework requirements to get that advanced practice credentialing, which is what you would ultimately aim for as a specialist pharmacist.
For sure. That's really incredible. I'm going to hand over to Elle now, who I can see there's heaps of questions in the chat box. So I think she's going to filter through them and read them out.
And yeah, I know because we're pushing for time because we like to talk about ourselves. If we can't get through them all, if you guys wanted to send them to us and we can answer them offline as well, if you like.
Yeah, that'd be awesome. Thank you guys so much. I'll just try to summarize them because I think they're all asking the same thing. Most of them are just about how they can build their resume in a way that would increase their chances to getting into hospital pharmacy in their internship, as in anything that they can do at uni or outside of uni, or what they can put in a resume to increase their chances to get into hospital pharmacy. You kind of already touched on that, but yeah.
Do you want to go, Stu, or do you want me to?
You go with this one. You've been interviewing interns for longer than me.
Okay. So I guess essentially when through New South Wales Health, we have your resume that you would put in, but then we also have selection criteria as well. So I guess there's only so creative you can be with the resume, and they're often very type of generic documents. So yes, it's great if you've worked in a pharmacy throughout your pharmacy degree. I guess that shows that you will have a really good understanding of how either community or hospital works. You get more exposure to the medications in that face-to-face kind of practical sense. So that for us is a tick in the box. We really like seeing if you're engaged in the profession as well. So for instance, if you're a member of SUPA, or you attend SHPA CE events, or you do something over and above for the profession, or to learn about the profession, what you would do in your day-to-day student life. So I guess they're the two things on a resume that we'd probably look for. In your selection criteria, what we're looking for is a little bit more depth about you and what your knowledge is and your scope of practice, and how or what your values and culture are with regard to pharmacy. So with your selection criteria, we'd probably say make sure that you put in lots of innovative examples in that selection criteria. Don't tell us that you did a Ventolin counselling and you made sure that the patient had the right proper technique. We hear that from everyone. Tell us something really innovative, like something where you've made a real difference in that patient's medication journey. So it may be someone that's come in that's speaks a different language, or they've been visually impaired, so you've done them a medication list with pictures on it or bigger writing to make sure that they understood. And then when you do that, use a good structure as well. So we use what we call the STAR technique in public health, but there are multiple ways that you can structure those selection criteria, but really make sure that you shine a light on what you can offer and your strengths as a pharmacist or a pharmacy student coming in to be an intern.
I would just say it's all very true, and I think the key there as well is there's lots of, if I was to say one thing, there is lots of things you will see and lots of things you will be told in your hospital placements or your community placements or at uni. I don't really care what you've seen or what some amazing pharmacist in a hospital showed you. I want to see how you have assessed that and what you've learned from that. So it's not about getting a student placement at a tertiary hospital that happens to do bone marrow transplants and you got to see a patient that you could tell me about that no one else will ever see. I want to see how your brain has worked and the thinking that's gone into it.
Yeah.
Thank you for that. I think that's going to help a lot of people in their applications coming up soon. And just touching on this, so from everything you're saying, it doesn't seem like marks are, have that big of an importance in terms of applying to hospital pharmacy. Is that correct? I'm sure it plays a role, but it's not as...
I would say it depends on your hospital, to be honest. Like in New South Wales Health, most hospitals aren't specifically looking at your grade. I know, for instance, when I applied to be an intern in Queensland Health, there was one specific hospital that you had to get basically a GPA of 7 to get into that hospital, and only the people who were close to that applied. But I think in New South Wales, there's a lot more variety, and you'll find that at least 3/4 of the hospitals are more concerned with the other skills that are required to be a pharmacist, rather than whether you can remember exactly what was in a textbook and regurgitate that on the right day in a test.
Okay, that makes sense. And also we have a few questions regarding hospital positions while we're still at uni. So someone's asking if there's a chance that a hospital will let a first or second year student work with them, or even third or fourth year students. Like, is there many opportunities for students?
Yeah, there's quite a lot now.
You've got students, don't you, Fallon?
We do, yeah. So we take 2 weekend students. that work Saturday, Sunday, and then we also have a casual roster of students as well. Basically, it comes down to availability. So we interview for our students around now or in September or so for the subsequent year. So we will take any year student for those positions, but they just have to be available for the days that we're requesting.
Okay.
I don't know of anywhere that would currently employ first and second, if only because it's also about balancing how that works with your units of study and things.
We've had a couple of second years over time. Yeah, actually one of our residents now started with us when they were in second year of pharmacy, and she's now doing a foundational residency. So
Stand corrected.
Yeah.
Okay. Does anyone have any last minute questions before we move on to our next speaker? No. Okay. Thank you very much, Stuart and Fallon. I really appreciate you sharing your experiences, and I'll hand it over to Annabelle again.
You're welcome.
Thank you.
So up now we have Elias, who's our industry representative. We'll just jump straight in first. So can you give us a quick overview of industry? It's, I guess, a concept that a lot of us are a bit confused and weary about because it's not so much in front of us. So are you able to summarize what's the pharmaceutical industry and just some key positions in a few minutes?
Sure thing. Thank you, Annabelle. I want to thank yourself first and SUPA for allowing me the privilege to be part of this great discussion today. So thank you. And it's a special moment for me. I was a former SUPA president, so to be back here at SUPA is really special to me. So thanks again. Pharmaceutical industry. So in a nutshell, these are the companies and the manufacturers who take a molecule right from the beginning at development and take it all the way through clinical trials and the commercialization process to bring it to the hands of clinicians for prescribing and for access to patients to have. That's just in a real nutshell. It is a very complex and long process, but that's where the manufacturers sit. If we were to look at what are the key roles, I mean, the first thing I would say at the moment is there's lots and lots of roles. So today I'm just going to choose a few just to give everyone a bit of a flavor, and really probably the ones that are more familiar with yourselves or allow opportunities as pharmacists to get in. So the first one I'm going to say is the roles that belong to what we call the medical affairs department. And this is an area where lots of pharmacists go into because that's their grassroots. It allows them to use their clinical skills in the place of pharmaceuticals to deliver pharmaceutical or medical information to our clinicians, to our specialists. And you would have heard Fallon talk a lot about medical information. That in itself is a role and is a really good one for an entry point of pharmacy because they're the ones who are involved at answering the questions from the field, from patients, from GPs, from specialists about drugs in the company's portfolio and providing them with that specialized information. So that's one area. The other area probably that you have all heard of is something called regulatory affairs. So why do I bring up regulatory affairs? They're a key, and you probably would have heard a lot about TGA and all that in the COVID crisis at the moment. So the regulatory affairs members are those involved with taking a drug that's recently been developed and taking it to the TGA for review and approval to allow the company to be able to market it and allow clinicians to prescribe it and allow the company to sell it in a pharmacy. So without its TGA approval, the drug cannot be at all marketed or sold in Australia. And then the other area I'm going to mention is market access, or another term that some people might think of market access is reimbursement. And why do I mention that as key? You might have all these new drugs that we're hearing about, the highly specialized, high cost targeted therapies, but it's all good to get them TGA approved, but our customers and patients cannot afford them. So the market access team are those that take our medicines, they submit them to a committee known as the PBAC, the Pharmaceutical Benefits Advisory Committee, and put a submission to them on what the value that is delivered by these medicines to the community and to the government. And this committee makes the decisions on allowing these medicines to be listed on the PBS. And when we get those medicines on the PBS, those patients can afford them and also allows our clinicians to be able to write it for them. So that is in a nutshell, I thought I'd give you, covers 3 key areas.
So as you mentioned before, well, I mentioned before, you currently work at Oregon. I think that's how you say it.
Organon.
There we go, Organon.
That's all right.
But I know you have relatively worked in most sectors of pharmacy. So are you able to outline your journey from graduating pretty much to the current position you're in?
Yeah, no, thank you, Annabelle. Yeah, look, as you mentioned, my journey hasn't been straight into industry. I've got an industry, a journey that's covered most facets of pharmacy. So I did my degree, obviously, at UCID. Coming out of there, I was quite keen on experiencing all facets of pharmacy. So the first few years of pharmacy for me, I actually spent time in community pharmacy. I worked in hospital pharmacy. I even did overseas pharmacy. Became registered in the United Kingdom as a hospital pharmacist during my time traveling through Europe. But then when I came back from my travels, I became quite focused. I found my passion at the time through my different experiences. And that's where my passion was, in community pharmacy. So I came back with a focus, got my experience up in that space. And my next phase was to go into pharmacy ownership. I spent the next 10 years, I spent in ownership in a pharmacy in inner Western Sydney, which was very rewarding for me from a professional perspective, the ability to make a difference in people's lives in the community. And that was great. But then after 10 years, I decided to sell my business. And that's when my wife pulled me up and said, I think you need to give the industry a go. And the reason is my wife's a pharmacist as well. And she was an industry pharmacist. And she said, look, you just need to give it a go. Because when I was going through it, it was seen as the dark side. Like you said, no one knew about it and everyone was a bit concerned. And I said, look, let's give it a go. And so basically I gave it a shot and used the entry point of the medical affairs department. Like mentioned before, I went into medical information and I did that for a couple of years. And the great thing about industry is that with industry, it's where you want to take it. There are so many opportunities there. I support what, as Stu said earlier, get your foot in the door. And then from there, you can go wherever you want. As long as you're driven and you're passionate and you're hardworking, you can take the opportunities, and the development is there on the job. So for me, after 2 years in medical information, I then made my way into the reimbursement space. So working on market access, pricing, the financial side of the business. And if anyone wants to know what that area is also known as, it's the discipline of health economics. So it's about how to assess the value of a medicine in the health system. So that's the type of work that I do. And that's where I am today.
Can I ask, as a side note, did you have to do further study to focus on that? Or did you just, I guess, pick it up as you're going in industry?
No, great question. So no. So look, if you want it to be your key focus and it's where you want to go, then when you go into industry, you don't need it to get into the industry. You can study it. Health economics is actually a discipline. You can go get a degree or a postgrad degree in it, but you don't have to, because I'll be upfront and say to you that I actually learned it on the job. So the training was provided and you develop along the way. So it's not an absolute must. And one other thing I think I didn't mention earlier is also that I'm an accredited consultant pharmacist, and still till today, see a couple of patients a month doing HMRs. So it just shows you my passion in the community space.
I was going to ask what drew you into industry, but it sounds like your wife from that. Were you always passionate about it, or is it something that your career choice naturally progressed into?
Yeah, look, it was a progression piece, because like I said to you, if you asked me this question, 10 years ago, it was the dark side and I never would have gone there. Yeah. But yeah, today, I'm definitely very passionate about it.
And I was going to say industry can be quite scary to students because there's no direct path in terms of graduation or internships. So if you had to give about 3 to 4 pointers to university students on how they can get into industry, what would they be? Yeah,
no, look, I want to tell everyone, like you've heard from all the great speakers today, just give it a go. I know there's a lot of uncertainty out there and people might not know how to get in and whatnot, but I have to be upfront. There are roles that are, that are advertised. You just got to give it a go. And it's all about getting your foot in the door. It's the same message you're hearing from all the great speakers before me. Get your foot in the door, because once you're in, you can move around, you can develop and you can grow. Now, I want to tell you that there are internships. This is a space that's starting to evolve now in industry. I have been a preceptor for pharmacists in industry. So I can tell you now that there are roles out there every year. It's a growing space, I know. And what happens is it's a combined role of 6 months of industry and 6 months of hospital. Because to become a registered pharmacist, you cannot do all your hours in industry. Only 50% can be done. So the first option I'll tell you is there is internship roles that do pop up. So keep your eye on this space. Second of all, the other part is if you decide, let's say later down the track, you've done a few years of pharmacy and it's not about the internship role and you want to give industry a go, then keep your eye on these medical affairs roles, medical information, and even another space that I'm seeing pharmacists going to is actually becoming pharmaceutical representatives. So they're the reps who actually go out in the field and detail, GPs about medications. Again, that's another way of getting in. So pharmaceutical represent, but mainly medical information. To be honest, it's the way I got in, it's the way my wife got in, and a number of friends of mine is a good foot in the door because it's your grassroots, and you actually have to be a pharmacist to do medical information. So they're the key tips I would give you on entry points.
I was going to ask as well, is there benefit in getting that community or hospital experience first before moving into industry?
Not absolutely. So if you're coming down the path of the internship role, then obviously that's your first foot in the door. And then if you're coming through the other pathways through the medical information pathway, again, not absolutely necessary. But I do want to stress key, because it's a question that was asked for, if I was to stress key characteristics, then again, communication and collaboration are first and foremost. I know this is quite common about everything that you've heard today, but they're very important. And the relationship building. And then the other part is when you get into roles like mine, resilience and perseverance because of the challenges of dealing with the Department of Health and whatnot. But yeah, they're the key things that I would suggest.
And can I ask those that work for pharmaceutical companies, is there a lot of pharmacists or is it like Bachelor of Med Science, stuff like that?
There's a lot of pharmacists. I can tell you there's lots of pharmacists in the role, and the pharmacists aren't just in the medical space, they're spread right throughout the company. And there are people who've come in later and there are people who've come in earlier. And look, I can tell you there's people there is med science, there is science, there's doctors in there. I know people who are MBBSs who work in industry. But there's lots of pharmacists with very senior roles, very entry roles. They're all throughout the company, and they're well sought after.
And is further study recommended for industry? Because I've heard stuff about, for example, MBA, which is a business administration master's.
Look, I'll be very clear on this one. It's absolutely not necessary. If you want to, enter at an entry level and work your way up. Things like MBAs are things that are considered further down the track as you either, if you do decide to become more senior, but again, not absolutely necessary. The one thing that I do know, and I've seen people do in the past, is it's the part about pursuing postgraduate studies. And that's more, at a PhD level. And some people have gone and used PhDs as a way of getting into industry, specifically for higher level regulatory roles and for medical roles to become medical advisors or medical science liaisons. These are people who detail specialists on, the latest clinical and technical data. So but don't get me wrong, if you have a B Pharm, it doesn't mean you can't do those roles. It just means that you're starting at the bottom and working your way up. But postgrad can be a way just to get yourself a little further up the ladder, because I have seen that. But overall, I just want to tell everyone, don't start running out there trying to get your PhDs. You don't need it.
And I can see there's quite a few questions in the chat box. I'm going to hand over to Elle now, who will go through some of the questions.
Thank you.
Hi, Elias. Thank you so much for sharing. I'll just go through some of the questions that the students are asking. So a lot of them are asking how we can get involved in industry while still being students. Are there such opportunities?
That's a good question. The answer is yes. My understanding, again, this goes back to keeping an eye on this space. I have also personally been involved. I believe the University of Sydney does like a 12-week placement at one of, I'm not naming companies, but at one of the companies where they have an opportunity, I think in their 3rd or 4th year, please don't quote me, to have a small stint at the one of these companies. That's one. I know that, for example, UTS has I think in their master's program, they have a industry type of degree that you can do. You can do a Bachelor of Masters of Pharmacy brackets industry, which also allows you to have overseas or local experience. There you go, Andrew nailed it. So yeah, it's because I've hired some of these pharmacists, and that's why I'm aware of it.
Okay, thank you for that. Okay, someone's asking, how did your degree transfer across to the UK? Yeah.
Yeah, so I believe that this has changed for today. You'd have to look into it further, so please don't take my word as gospel at the moment. But back when I did my pharmacy degree, there was a reciprocal agreement between the United Kingdom and Australia, where there was immediate recognition of our degrees. And I only had to do 4 weeks of supervised training in a hospital in London, and I was registered as a pharmacist in the UK. I don't know that that is still the case. You would have to investigate further, but there was a reciprocal agreement back in the day.
Okay, that's interesting. Okay, another question that we have is, what is the biggest misconception about industry you had as a community pharmacist that changed once you became involved?
I don't know about misconceptions. I think we just don't know enough about the industry. To be honest, as a pharmacist, you know, when I was there, all I knew about industry is, to be honest, we knew they made the drugs. We knew there was reps who came and visited our pharmacies, so we saw that face of it. And we've all probably heard about regulatory affairs because we know about them and the TGA and getting medicines across. But I guess we don't know about all the amazing innovative work that they do. And I mean, if we think about it today, a good example is the COVID vaccine. I mean, the way they've pulled together and the innovation and investment that they've done to deliver a vaccine within 12 months, it just speaks to the amazing work they do in saving lives. And I believe that, you know, the advancements in medicine is really driven by academia and also the pharmaceutical manufacturers. So for me, it was more the misconception of not knowing enough about them. And it's really opened my eyes to the opportunity and the great work that they do.
Okay, that makes sense. And that will probably be the last question. Okay, it's in terms of the roles that you were talking about previously. So that 6-month placement at the industry and 6-month in hospital, not placement, like internship. Where can they find these positions advertised?
That's a good question. I believe that's one of 2 places. I do believe it is posted online, like as in potentially in, you know, your usual like Seek or Indeed or whatnot. But I also do believe that this is also posted on the university. I can't say whether it's on a, you know, whether you have a specific internal, you know, employment or notices board, but I do believe it gets posted at the university.
Okay. Thank you very much, Elias. I'll pass it on to Annabelle again.
My pleasure.
Thank you.
Okay, so now we're up to our research pharmacist, which...
I missed that.
Oh, sorry, that was Siri. I'll just pull up the questions. So we have Professor Sarira.
I'm not a professor, just a doctor.
I'm so sorry, I don't understand your name.
No, don't be sorry, that's all good.
Okay, so our first question would be, what drew you into becoming a research pharmacist?
Sorry, I missed that. What did I?
What drew you into becoming a research pharmacist?
What drew me to become a research pharmacist? Look, I did honors in my, well, first of all, I did my Bachelor of Pharmacy up in the Northern Territory at Charles Darwin University. And in my 4th year, just like everyone at Sydney has that potential opportunity, there was the honors program and I got into that and I really enjoyed research. So during my intern year up in the NT, I started applying to PhD programs. And I guess it was really honors was the first kind of real taste of research that made me thinking I want to do a higher degree research degree. Before that, I had done like a short-term kind of research project where I helped out one of our professors with some data analysis and data collection. And that kind of gave me a taste, but honors was really what made me want to go for it.
Cool. And the next question was going to be, what path did you take to become a research pharmacist, including honors, PhD, etc.?
Yeah, sure. I guess also in relation to the first question, my parents are academics, so I kind of grew up in an environment where they were working at universities, and I traveled with them to conferences and stuff like that. So from a young age, I was kind of climatized to all that, and I thought, oh, this is a nice way to make a living. So I did have a little bit of that influence me. In terms of my pathway, I did well in my honors year, which enabled me to go straight from honors into a PhD. I really wanted to do my intern year and become a registered pharmacist. So even though there may have been an opportunity to go straight from B.Pharm directly into the PhD and bypass that, personally, I felt that there was great benefit, and I still do, in completing the intern year. So I did that and applied to some PhD programs and got into the one at Sydney Uni, where I did my PhD with Tim Chen and Claire O'Reilly, who I'm sure all of you would know. And I finished up about 3 or 4 years ago, and right place, right time, there was an opportunity to become a lecturer, and I applied for the position, and that's kind of how I got there.
And I was going to say, can you tell us a bit about your specialization research? Like, what was your PhD about, and how did you select your specialization as well?
Yeah, great. So during my honors year, I knew I wanted to do something around women's health. I was always very interested in that. And during my honors year, my project focused on looking at over-the-counter medicines for premenstrual syndrome, and I did a survey of pharmacists. So I really enjoyed, exploring women's health issues, and I guess I thought, I guess it could be relevant to me because I'm a woman, and I kind of wanted to stick with that throughout my PhD. So initially, I didn't end up doing the PhD topic I thought I would. I wanted to look more at epidurals in hospital pharmacy and that kind of thing. But once again, there was an opportunity. One of the professors that I emailed let me know that he was starting a stream of research around perinatal depression, so perinatal mental illness, and really exploring what's out there in terms of pharmacist roles and specifically community pharmacists. And I thought, that's still women's health, and I guess that could be interesting, and started reading more about that and writing a proposal and all of that. And eventually I got into that program and really enjoyed my PhD around perinatal depression. But I guess it didn't really stop there. As part of, I guess, researching in mental health in general, what also became apparent is the need for education in that area. And one training program called Mental Health First Aid, which all of you fourth years will have an opportunity to take part in later on in the year, was something that I really enjoyed. I attended a course and then eventually did a study around it with pharmacy students back in 2015. And slowly I've kind of branched into not just the perinatal mental health, but also mental health education, not just for students, but also for pharmacists more broadly, I guess.
So your field's kind of, I guess, developed over time.
Definitely. And that's the thing about a PhD, it does equip you with the skills to apply what you've learned through the PhD to other research areas. Not saying that you can't, be in a very focused area and have a whole 50 years of a career on that, but sometimes you can also branch out if that's something you're interested in.
Yeah, and I was going to ask, because as a student, I'm quite confused as an undergrad student. With a PhD, how does it work? Do you I guess, apply to universities, and then what happens from there?
In terms of once you're done with the PhD?
Or before, like the process of, I guess,
getting in to do a PhD.
Yeah, working underneath, like,
Yeah, so the two main pathways in Australia are if you have a, and look, universities might be slightly different, but in general, if you have an honors degree with first class or upper second class honors, then you're able to apply directly for a PhD. Because then you can demonstrate that you've had research experience and performed well. Alternatively, look, not everyone goes into honors, and that's fine. Many people a year later, 10 years later go, I'm thinking about higher degree research. There is also something called a Master of Philosophy. So PhD is a Doctor of Philosophy, but there's also a Master of Philosophy. So people who have a B.Pharm without an honors can apply for a Master of Philosophy. And then the Master of Philosophy is a lot shorter. So it's usually about 1 to 2 years, depending on the program. And then once you've completed that, then you can apply for a PhD. And that doesn't always have to be in the same area. Sometimes it is, but it doesn't necessarily have to be. So those are the two kind of main entry pathways. In terms of applying, like, yes, of course, like every degree, there's a form and there's an online system and etc. But really it also comes down to, I guess, what's unique about research degrees is that you often need to reach out to potential supervisors. So you need to be aware of different lecturers, professors, researchers in the area and kind of go, okay, I want to do something in women's health. You know, there's these 3 academics at Sydney or, you know, whichever university. This one's line of research is it might be pharmaceutics. That one might be pharmacy practice. This one might be health economics. You know, this is what I'm most interested in. I'm going to email this person and see if they've got, a study. Some other times there might be opportunities advertised because sometimes funded research might have positions for PhD candidates. And those are often promoted through the universities where the research has been funded.
Perfect. And on the back of that, what employment options are there for pharmacists who complete a research degree? Are pharmacists hired for these roles by companies, hospitals, universities?
Yeah, sure. Look, the thing is, and I said this to start off with, I think it's so important to complete the intern year, because just because you have a PhD doesn't mean you can't go work in community pharmacy or in hospital pharmacy as a clinician. And even if you do pursue a research career, I have many colleagues and friends who continue to do a night shift or a weekend shift in community and or hospital pharmacy. So it's definitely possible to continue to do both. It doesn't mean you have to abandon the clinical side of things if you become a researcher. I guess though, as you would know, a lot of researchers do become academics. But even the broader title of academics has various kind of roles within it. So there are some academics or people who work at universities who may only do research. So they might be involved in little to no teaching, and they have a line of research, and they're primarily focused on that. There are other people who may do more teaching than research, and others who might do kind of a mix of both. So even within universities, there are various positions. Junior researchers often join teams in positions called postdocs, or as postdoctoral research candidates. And that means they finish their PhD, and that's kind of that next step. And usually that's a time where they try to get their publications up and really contribute to research in whatever area. But as Elias mentioned, there's also other positions that open up with a PhD, such as in industry, but also in policy, and as well as through a PhD you learn a lot of essential skills in medical writing and report writing, and those can really be translated to various positions in government and that sort of thing.
Perfect. And I'm going to hand over to Elle, who I believe has some student questions ready to be asked.
Yeah, I just want to say I'm very conscious of time, and I am one of your lecturers. So if you'd rather, give this precious time to our amazing guest speakers, please feel free to email me or even book in a Zoom with me. I'm more than happy to have a chat about research offline. So don't feel like you got to give me too much time. I'm very accessible, especially now that I'm home.
Thank you so much, Sarira. That's actually very kind of you. I'll just go through one question that
Sure.
we have, which is, do you pick your PhD specialization, or does it depend on what the supervisors have available?
Yeah, look, I think different people will tell you different things. There are some people, for example, as I said, sometimes there's a study that's about to commence and they require a PhD candidate to start with them and see the study through. In those situations, by joining up for that study as a PhD candidate, then you're really kind of tied to that line of work. Having said that, given the fact that you would be the one applying for it, hopefully it's something that you're interested in. Otherwise, don't apply for it. In other situations, so for example, myself, I wasn't part of a big study that was funded during my PhD. Rather, it was a bit of a kind of a discussion between me and the potential supervisor that I had contacted. And we had kind of maybe over 3 months, quite a few, we didn't use much Zoom or Skype, 8 or 10 years ago, but we had a few phone calls. I was up in the NT and he was down in Sydney, and I even came down for a visit, and we had a bit of a chat about what I was interested in, what line of work he was commencing. And we really kind of came to the decision together. But I guess you can always put forward what you'd like, but it will really come down to that kind of discussion with your couple of supervisors, however many you may have. And look, just because you might start a project in one area, as I said earlier, mine kind of started to involve quite an element of education as time went on. It doesn't always mean that it's, stuck in stone. So and once you have the PhD, that's really your ticket to do all sorts of research that you may want to do. So it's never that if you start in one area, you must stay there forever.
Yeah, of course. Thank you so much for that. I'm very sorry we won't have time to go over the other
good.
questions.
Please email me. I'm more than happy to answer any research or any questions. Really.
Thank you very much, Sarira. Thank you. We really appreciate it. Thank you. I'll hand it over to you, Annabelle.
Yeah, so our lucky last speaker is Amy, who's our poison specialist, and emergency pharmacist. Here she is. Okay, so I feel like I personally know the least about this field, as perhaps we can argue it's the most specialized and unique. To start, are you able to explain what a poison specialist does, and what does your day-to-day life or work life look like?
Okay, thanks for the invite. So I wouldn't say that poison specialist is necessarily the most specialized. Everyone has their different areas of expertise. So the specialist in poisons information is generally employed by one of Australia's 4 poisons information centres. So this is a network of poison centres in Australia that are available 24/7 and take calls from the public and from other healthcare professionals and from hospitals about suspected poisonings or poisonings. So anyone can call up and say that they're concerned that their toddler has gotten into something in the home, and the poison specialist who answers the phone will ask some questions and make a risk assessment about what needs to happen. So if they can do some first aid at home, or if this patient's going to require urgent transport to the hospital, for example, via ambulance, or if they can follow up with their GP in a couple of days. And you'll also get calls from, for example, from emergency departments, from hospital networks that don't have toxicology, with patients who have come in potentially with polypharmacy overdose. So they've taken multiple medications intentionally or by mistake, and then they just need help with risk assessment and management of those patients.
I'm going a bit off script here, but I'm curious myself, how do you, decipher what the right decision is in the moment?
So probably one of the most important bits about that is a thorough history taking, and that is a skill set that every pharmacist in every area of practice needs to have, no matter where you work. So making sure that you've got all the right information to hand from the patient and all the relevant information, and then having your clinical knowledge and your resources. So we've got some extra toxicology databases that are available to us. The primary resource in Australia is the Therapeutic Guidelines toxicology book, which was written by a lot of the staff members at the various poison centres and toxicology units around Australia. And then I guess you go from there.
And are you able to outline your journey from graduating to the current position you're in? Like, how did you find yourself in this position?
So I did my BPharm at Sydney Uni, and then I got a internship in Queensland for Queensland Health, moved up to Brisbane, and was lucky enough to be able to rotate across many different areas of the hospital. And the thing that really stuck with me during my intern year was the emergency department, emergency medicine rotation, which I found really fascinating. So then when I got my registration as a junior pharmacist, you continue to rotate across lots of different areas, but I kind of found my passion and tried to do everything I could to get into emergency medicine. And then one of the hospitals I was working at, in the emergency department, we had a high frequency of patients who came in with overdoses, and the doctors would always call this Poisons Information Center, and they would just tell them amazing information. I was like, how do they know all that stuff? How can I find out what they know? And then eventually a job advertisement came up, and I did as much research and study as I could about toxicology and poisons, and applied for a training job at the New South Wales Poisons Information Centre. And then once we hire new staff members at the Poisons Information Centre, we have quite an intensive training program, because currently in Australia, there's not really any formal qualifications that you can obtain to become a Poisons Information Specialist. So what we do is we have about 3 months of lectures and shoots that we get people to do, and then they have quite a bit of supervised practice, and then there are a couple of exams that we get our junior staff members to do. Then they're able to work independently as a Poisons Information Specialist, assuming that's all gone well.
And what's your current job, or where are you working at right now?
So I have a couple of jobs. So my job at the Poisons Information Centre is as a senior specialist in education and training. So I'm lucky enough to help hire new staff and get them trained up, and also looking after our students. So we've got 2 industrial major students. I saw a bit of stuff in the chat about that earlier. So they're really great. They come along and learn a bit about the Poison Centre and help us out with some of our projects that we're doing. And then my other job is as an emergency medicine specialist, and also as an intern preceptor at one of the other hospitals in Sydney at the Northern Beaches.
Amazing. So what really drew you into this field initially? Was it just like the pure curiosity of like, how do these people know what the right decision is, I guess, in the moment? Or
I guess so. And one of the big parts about working in poisons or in toxicology is there's a very scarce amount of evidence. So it's one of those jobs where you really need to go back to first principles and really think about the pharmacokinetics of the drug and all the different receptors that it affects. Because when somebody takes something in excess, then it's not only, if say, for example, if it's specific to one type of receptor therapeutically, but also acts on some others, it's going to have effects on all those various receptors. So you need to be thinking about all of the effects that the medication might have, and also really consider drug interactions if people take multiple agents.
Yeah. And what are some highs and lows of being a poison specialist?
So definitely, highs are you really feel like you're helping the people. So people call you a lot of the time very distressed. And so having that sense of being able to help someone, which I think is a big characteristic for pharmacists in all areas of practice, being able to calm them down, get the information that's required. And my favorite is always when you can say, you'll be fine. What's happened will be fine. You'll be okay. Take a deep breath. There's always obviously the sad cases where we do need to arrange urgent transport and discuss with other services. But yeah, definitely the highs is when you can calm down that parent that's freaking out.
Yeah.
I don't know. I can't really think of many lows. I suppose if you don't like shift work, that's a low. So because it's available 24/7, I was working Saturday night until Sunday 6 a.m. So I'm a little bit tired now. So I guess it can impact on your social life, but Saturday night shifts, you probably get some of the most interesting calls. So.
Wow. And on that note, can you share with us one of the more memorable cases that you worked on?
Well, there's quite a lot, I guess. I had an interesting one with the everyone at home at the moment. Earlier today, there was a mum who called up because everyone was at home and they were trying to do the kids' science experiment. And so this science experiment was working out at what temperature crayons melt for the different colours. And they weren't melting according to the school's instructions. So they put them in the oven and smoked out the entire house. So they were fine. We just had to get some fresh air and that kind of thing. So I guess that was quite interesting. But then probably our most common calls are related to toddlers getting into household products. So, that's pretty run of the mill. And then quite a lot of polypharmacy overdoses. So I always get, I guess, a little bit excited when you have a really complicated set of medications that somebody has taken, because you really have to think about what you're doing and the best way to save that person's life.
For sure. And on that note, I'm sure you've intrigued a lot of students. So how can a student become a poison specialist in future?
So it's one of those jobs that requires a couple of years of experience. So you need to become registered. We don't take interns at the moment. And we do usually require that somebody has several years of experience working in pharmacy. Doesn't matter what the setting is. So it could be in community, could be in hospital. Ideally, they need to have really, really good communication skills, which is something that's been echoed multiple times tonight. And also an ability to look things up quickly and synthesize information quickly and then relay that back to the person on the end of the phone. It's really important to be able to adjust your language because we get such a wide variety of people calling. You can't use the same set of language that you might use for a stressed out parent versus an emergency medicine specialist, a doctor, for example.
Of course. And now we're going to open the floor for any student questions. Elle, when you're ready.
Yeah, I'm aware we're over time, so I'll just go over one question, which is, are there any students opportunities? And I'm assuming not just as a job, maybe as an internship or placement, to be more specific.
Yep, we take lots of students on placement.
Yeah,
so we've got 2 industrial major students at the moment who I think are online at the moment. And I guess it's a bit more difficult to do placements at the moment in this COVID era because it's a telephone service. We've got the luxury that all our staff can be working from home at the moment. So student supervision is a little bit more challenging compared to when we were in the office. But we've been finding new ways to do that, which has been really great. So we've been doing our best to take as many students as we can because we know that a lot of people have had trouble getting placements at the moment.
Okay, great. Thank you very much, Amy. And thank you very much for sharing your experience. I'm sure a lot of students are going to learn from your experience and all of our speakers' experiences. So thank you all for attending tonight. We really appreciate that time that you took out of your day to talk to the students. So thank you very much. I'll pass it on to Annabelle for the conclusion of the event.
Yeah, so we just obviously want to say thank you to all the incredible speakers. Like, you've taken so much time out of your days replying to emails and coming to this event. Like, we can't say thank you enough. And also thank you to students. Like, this has been such an incredible turnout. We are honestly speechless with the amount of students that came along. Like, we had 148 people here at one stage, which is insane for an online event. And yeah, and I guess thank you to the university. Thank you to all the people on the SUPA team that have helped out this teamwork. Like, COVID has just made teamwork a major thing. So thank you to everyone. And of course, our Dean for joining us tonight. And we just want to open the floor to any final questions. We've been so lucky that the speakers have wanted to stay around and answer any. So pop them in the chat or unmute your mic. I guess we'll hang around for another 5 minutes if there's any burning questions, if that's okay. But speakers, if you need to go, there's no problem with that at all.
I think we're all here. Happy to chat. Easier than replying to emails. I'm a very slow typer. I think I've already responded to everyone to a direct message. I'm not very good at Zoom. It's not a New South Wales Health thing. Sorry.
What do you use at New South Wales Health?
We what do we do?
Skype,
Teams.
Skype for business.
Skype and
Microsoft
Teams. Yeah.
Yeah.
I prefer Teams because at least we can put backgrounds in so you can't see where I am.
Yeah.
Skype is very old school. Surely someone has more of a question than that, though. That's not worth hanging around for.
No, I think that's all right. I think we held you back for too long, so thank you very much for that. And thank you for answering the questions in the chat. I was looking at all of your answers. Thank you so much.
I can see one question. Sorry to hold you. Can international students apply for New South Wales health jobs?
Yes.
Yes.
But you have to have the right visa, and I don't know what that is. I would have to ask HR. So if you're going to apply for a job at New South Wales Health, I'd probably just email the person at the bottom of the application with whatever visa you have, and then they can pass that on to the HR team just to confirm that you qualify for whatever position it is you're applying for.
Absolutely, yeah.
All right, guys, any final questions? Speak up now.
I just have a question for Amy. Amy, what sort of resources would you find yourself turning to in order to figure out cases that you haven't come across before?
Well, it depends what the case is, I guess. So if it's something to do with a plant, so if they've eaten a plant, hopefully the person on the other end of the phone knows what the name of the plant is, because that's probably not their number one challenge. If they're just describing something, we're not able to formally identify things over the phone. So we've got a database that's called Toxins, which is based in New Zealand, as your name would guess, and that's really helpful for plants. So that just basically breaks them down into different categories that we understand. If it's a household product that you've never heard of before, there's a National Poisons Register where all companies have to give us information about their products. So if you go buy something from the supermarket and it has the poisons information phone number on the back, that it should be in that database. If it's not in that database, then you'd be looking for the material safety data sheet, which can usually find on Google or on the manufacturer's website. And if it's a medication, most of them are in the ETG, the Therapeutic Guidelines Toxicology. Of course, there's always like more new and emerging medicines or things that have only been registered for a couple of years. And we're always actively doing research on that. And we have a lot of internal sort of preliminary information that we've got access to. I guess it would be similar to medicines information processes.
Can I ask a question, Amy? Do you have access to a botanist or something? So if someone rang you up and said, I think, well, I've eaten a mushroom or I've eaten a plant and I'm not quite sure what it is, but I have a photo of it, is that something that you can kind of refer off to someone and then come up with a solution? Or...
Unfortunately, no.
Okay.
We often refer people to their local nursery to see if their friendly nursery will identify the plant for them and then bring us back. Because we're worried really about poisons and poisoning effects, we base a lot of our advice off symptoms. So if somebody's they've rung up and they've eaten a mushroom and they immediately vomit that and no other symptoms, then that may not be a concern, because if you've eaten something a bit strange, you're likely to get gastritis, GI effects from it. If, for example, they're vomiting 6 hours after they've had the mushroom, be worried that they might have some hepatic injury from it. So it's more, I guess, based off symptoms. And I guess the other issue with plants is when people go out and pick them, if there's like a cluster of mushrooms, for example, not all the mushrooms may be the same. So the one they ate may not be the other one that they've got in their hand. So it makes it a bit tricky.
Awesome. Thank you.
For the really sick patients, if they're lucky enough to be in Victoria, the Victorians have access to a mycologist that can help with mushrooms.
Awesome.
All right. Elle, should we close the Zoom in about another minute or two?
I have one question, if you don't mind. May I ask? It's for question for Fallon or Stuart. Fallon said that there are some foundational SHPA residency positions can be offered by different hospitals or something else. It is the positions that is offered by the graduate, like for the graduated students, or just the like students who are in the second or third year?
So their positions, you have to be a registered pharmacist. So they're positions that you would do after you complete your internship year. And then ideally, they're targeted towards pharmacists within the first 5 years of their career. So it would be, you would get registered as a pharmacist, and then within that first 5 years, you would undertake the foundational residency program.
Okay, and they have the requirement that they have their own requirement to allow people to get that residency positions?
Yeah, so there's two different options. One is the hospital will offer a specific residency position that you apply for, and then you would have the hospital's criteria. Otherwise, if you're an existing employee of a hospital and your department is willing to support you to do that foundational residency program, then all you have to do is apply to SHPA, and they don't say no to anyone, basically, for the foundational residency, because the whole point of it is that it's for pharmacists who are transitioning from community pharmacy to come into hospital, to have a structured learning curriculum to help them to learn about the differences in community and hospital or industry or any other area. Yeah, so it's not, yeah, it's essentially, you can either do it as a definitive position and get a 2-year contract, or you can do it within an existing position. If your department is willing to support that, and SHPA will let anyone who would like to do it join.
And the duration is, sorry.
That's right. It's quite an emerging field. So if a hospital needs to choose on its own merits to run a program, it needs to make its own curriculum for that. And essentially it's fully supported by the hospital, but in alignment with the values and the requirements of SHPA. I think it's something that we'll really see, and certainly if Fallon and I have anything to do with it, is something that we'll see being a growing way of developing your career and developing skills within pharmacy in the future. But at the moment, especially in New South Wales, is quite lucky if you can find one. And North Shore and Fallon and her team are one of the sites that are really supporting that quite strongly currently in New South Wales.
Yeah. It's a great avenue for career progression, and I think often career progression has been left up to the individual in the past, so it's nice to be able to provide a structured career progression for pharmacists in the hospital sphere with this new program.
Thank you.
And I can see one last question for Elias. I think he's trying to ask if you still practice in community, and if it's necessary to practice in community to maintain your license while working in industry. Oh, we can't hear you, sorry. There.
Apologies. So I do still practice in community, but more on a when necessary or locum basis. So I no longer regularly work. I still do regular work in HMRs. You don't need to be registered, first of all, for the perspective of the industry role, but I do maintain my registration, and that's through my ongoing work through community, my work as well in the HMR space, because I am still doing regular clinical practice. So that's how I maintain my registration.
Okay. All right, guys, I think we might leave it here for tonight. Thank you so much to all the panelists. You've been so incredible, and thank you for spending your Monday night with us. We know we went over the time, but we really, really appreciate it.
Most welcome. We're glad to be here.
Thanks, Annabelle.
Thanks very much, everyone. You did a great job.
Appreciate it.
Well,
Thanks, everyone.
Thank you.
All the best.
Bye.
Thank you, guys.
How good.
Hang on.
Well done.
Hang on.
Well done.
Nice
I'm
job,
just trying to
guys.
see, do we still have, oh. Okay, I think it's all good.
Shout out to Dan for trying to make me laugh the whole
Oh
time.
my god. Awesome work, Annabelle and Elissar. That was so good.
Really?
Sorry, I was so stressed.
The start, PTSD for life from that. Kristen,
Oh, that was good. That was actually really good.
yeah, did you guys like it? I
That was
No,
actually
let me
really
stop the
interesting.
recording. Wait
It
one
was so
second.